This spotlight on employee benefits is sponsored by AFLAC, providing a safety net for families. Get started with AFLAC today and visit aflac.com/brokers. MIT economist John Gruber says in a report that alternatives to the individual mandate provision of the health care reform law would leave millions without coverage. The study, conducted for the Liberal Center for American Progress, examines two proposed alternatives. The first option would use a system similar to the one employers use for 401k plans. Workers would automatically be enrolled in a plan, but they could opt out if they don't want the coverage. The second would impose penalties on individuals who wait to enroll in a plan. Gruber's study says that allowing employees to opt out would be problematic because employers wouldn't be incentivized to encourage employee participation. Also, participants can't get their money back if they spend more on premiums than health care, and most young people would likely opt out since many of them currently don't want it. Gruber also says imposing penalties on people who choose to enroll in a policy late, such as barring them from purchasing insurance in the new health insurance exchanges for 5 years, is a flawed strategy. Such a penalty would result in 12 million people gaining coverage, just 1/3 of the expected number of people who would gain coverage under the individual mandate. Additionally, Gruber says it would cause premiums in the exchanges to rise 20% and would reduce government spending by only about 25%. Republican governors want the Department of Health and Human Services to give states more flexibility when implementing the health insurance exchanges required by the health reform law. 21 Republican governors sent Health and Human Services Secretary Kathleen Sebelius a letter outlining 6 changes to health insurance exchange requirements they deem critical. The governors say the healthcare law in its current form threatens to destroy our budgets and perpetuate and magnify the most costly aspects of our healthcare system. Among the changes requested are giving states the right to choose benefits that meet the needs of their residents, waiving provisions that discriminate against consumer-driven health plans, and allowing flexibility to move non-disabled Medicaid beneficiaries into exchanges. A Rasmussen Report survey shows more voters than ever think states should have the right to opt out of some or all of the healthcare reform law. According to the poll, 54% of voters say states should have the right to opt out of the entire healthcare law, compared to 47% in December. In addition, 54% think states should be able to opt out of portions of the law they disagree with. When asked how they view the individual mandate provision of the health reform law, 58% of respondents said they at least somewhat oppose the requirement, and 44% strongly oppose it. Another 39% say they somewhat favor the requirement, and 21% strongly favor it. For more industry spotlights, visit producersweb.com.